This presentation is about the cultural factors and health disparities for individuals suffering with prescription drug, illicit drug, and alcohol addiction. Media portrayals of individuals struggling with addiction are often extreme and not representative of the general population. In many cases, these portrayals may actually incite others to use harmful substances. Multiple studies by Quarterman have demonstrated that individuals who view addictive substance usage in movies are more likely to partake themselves. Additionally, they conclude that substance abuse in movies may be more powerful than advertising because the message is not perceived as advertising. For many years, news coverage portrayed individuals suffering from addiction largely as criminals, but recently the focus has shifted to more open discussion of the factors leading to addiction in all groups in society. This more open and accurate portrayal has allowed many individuals to admit their addiction and seek help without as great a fear of criminal persecution or being shunned by friends and family. Addiction affects the entire family. In a family, each member plays a role to help the family function well and have stability. There are 6 different family roles that are used to understand how a family functions around the substance abuser. We have the enabler. This person takes care of all the needs of the substance abuser and doesn't recognize substance abuse as a problem. Then there's the hero, who takes on additional responsibilities in the home and often assumes parental roles. They compensate the empty feelings they feel by being a superstar. The scapegoat is a child who misbehaves, gets into trouble at school and home. These behaviors reflect the chaotic behavior found in the home. They are the person blamed for all the family problems. The mascot is the family member who is cheerful and tries to use comedy to balance the chaos in the home. The lost child is the person who isolates himself from the family and has difficulty in social situations. They avoid conflict and suppress their emotions. The addict feels shame, guilt, and remorse about the pain and distress they have caused the family, but still do not want to cease their substance abuse. This choice causes family members to feel angry and resentment within the family. Family support or lack thereof plays a role in the health outcomes for the substance abuser. Learning about addiction causes painful emotions and hopelessness and feelings of shock. Family support has been shown to help substance abusers complete an addiction treatment process and plays an important role in recovery. Family members may find that attending support groups are helpful. There are many support groups available for substance abusers in the family. Peer pressure can be defined as the process of giving and receiving non-professional, non-clinical assistance from individuals with similar conditions or circumstances to achieve long-term recovery from psychiatric, alcohol, and or drug-related problems. This comes in a variety of forms and is considered an important aspect in the addiction recovery process. For example, there are sober living houses. There's programs of Alcohol Anonymous and Narcotic Anonymous. And there are other self-help groups such as internet support groups and peer partnerships that can also aid in successful recovery. Abuse of prescription drugs, illicit drugs, and alcohol can be a multi-generational challenge. Familiar inheritance of drug abuse is composed of both genetic and environmental factors. Additionally, epigenetics, transgenerational inheritance may provide a means by which parental drug use can influence several generations of offspring. Recent evidence suggests that parental drug exposure produces behavioral, biochemical, and neural anatomical changes in future generations. Locally, there is several programs to help someone who is suffering from substance abuse. For example, we have the Davis County Drug Court Program. They have several programs, and often they refer individuals to Davis Behavioral Health and Weber Human Services. The state has a goal to decrease substance abuse and misuse 20% by 2025. And to help understand the gaps in the system and develop an understanding about how addiction begins, the state implemented a program they call the SHARP Survey, which summarizes the findings from the Utah Prevention Needs Assessment Survey. The survey is administered every 2 years in grades 6, 8, 10, and 12. The survey focuses on substance abuse and other negative behaviors in these age groups with an intent to use the information gathered to provide education about the protective factors that are known to prevent substance abuse and addiction. The survey includes every county in Utah. Nationally, there are several programs that focus on substance use disorder and prevention. In 2018, an act was created to address the nation's opioid epidemic. The focus of this program and many others to strengthen the health workforce, to increase addiction medication education, standardize medication delivery, and expand treatment. No physical or psychiatric condition is more associated with social disapproval and discrimination than drug or alcohol dependence. People who are stigmatized for their drug or alcohol involvement can endure social rejection, labeling, stereotyping, and discrimination, even in the absence of any negative consequences associated with their use. This takes many forms, including denial of housing, denial of employment, stigma towards other people who use drugs and alcohol, negative views from healthcare professionals. Stigma is a major factor that keeps individuals from seeking and utilizing services such as treatment and harm reduction programs. Social exclusion created by stigma causes a vicious cycle for those addicted to drugs and alcohol and usually increases the need for a variety of services. Abuse of prescription drugs, illicit drugs, and alcohol is a challenge faced by individuals, groups, and governments of every country. The method chosen by each country to combat these issues have varied, but can often be categorized as either war on drugs or harm reduction. War on drug focuses on criminalizing the production, distribution, and usage of controlled substances and using police and military to enforce, often resulting in imprisonment and or death penalties. Harm reduction focuses on interventions aimed at lessening the harm and risks of drug abuse. There's the clean needle and syringe programs, overdose prevention policies, supervised injection facilities, and opioid substitution treatment. The Centers for Disease Control considers low-income people and those on Medicaid to be at a high risk for drug overdose and addiction. People with less education and those facing economic challenges and psychological stress or physiological stress are more prone to substance use and addiction. Lower income people are less likely to have access to addiction treatment programs. According to the National Institute on Drug Abuse, preventing future drug crises requires addressing the economic disparities, housing instability, poor education quality, and lack of access to quality health care that currently plague many of the disadvantaged individuals, families, and communities. Healthy People reports that there is a powerful and complex relationship between socioeconomic status, physical environment, and literacy levels that influence people's health and substance use disorder. Blacks are significantly more likely than non-Latino whites to receive substance use treatment and specialty substance abuse treatment. Blacks have higher rates of alcohol dependence, illicit drug abuse, and illicit drug dependence than whites, but lower rates of alcohol abuse. Compared with whites, Latinos have higher rates of alcohol dependence and illicit drug abuse, but lower rates of alcohol abuse. Religious beliefs and association can be helpful for many individuals in recovering from substance addiction. There's a consensus among the analyzed studies on the protective effect and moderation of religiosity and spirituality to prevent the use of alcohol, tobacco, and illicit drugs, and that this effort occurs regardless of the religious affiliation that adolescent participates. Spirituality often offers a source of personal strength for the individual, a more optimistic orientation of life, and greater resilience to stress and less anxiety. Thus, approaches that consider this practice are effective for reducing relapses. Males and females respond differently to substance use disorders, and they often use drugs for different reasons. For both gender, there are negative health outcomes. For example, females will develop issues relating to their reproductive cycles. Depending on the substance that is abused, may increase the likelihood of infertility and early menopause. Substance use during pregnancy affects the unborn fetus and will cause harm to the unborn fetus. Women are more likely to have panic attacks and anxiety disorders from substance use disorder. Men are more likely to abuse illicit drugs and have more visits to the emergency department than women. They are more likely to overdose than women. Men have higher rates of use or dependence. Both men and women may have mental health disorders and low rate of seeking treatment. Substance abuse can be especially hard to combat in rural communities due to limited resources for prevention, treatment, and recovery. Factors contributing to substance abuse in rural America include low education attainment, poverty, unemployment, high-risk behaviors, isolation. Prevention programs aimed at youth using evidence-based strategies can help reduce alcohol and drug abuse in rural communities. Prevention and treatment of substance use disorders in rural communities. Toolkit and online support groups can also be useful for those who live in rural areas. Addiction stigma, which is represented by social attitudes toward individuals who use alcohol and other drugs, is one of the barriers to care that is poorly understood. Bias, thoughts, and actions can either implicit or explicit. Implicit bias includes attitudes toward individual groups or stereotype treatment with or without conscious recognition. And explicit bias means attitudes toward individuals, groups, or stereotype treatment at a conscious level because we view them as a potential threat. There's a study that found that while often people are not explicitly biased against individuals with addictions, many demonstrate implicit bias in believing that punishment is more appropriate than providing help. The study further looked at the compounding impact of race and this implicit bias and found that it was especially prevalent when the subject with the addiction was Latino. Globally, just over 2% of the world population are dependent on alcohol or drugs. In the U.S. and several countries in Eastern Europe, more than 1 in 20 are dependent. In the U.S., this is dominated by illicit drug dependence, whereas alcoholism is much more common in Russia and Eastern Europe. And these are just our references. Thanks for listening.